Yeah. So let's talk quickly because initially we were going to talk about surprise medical billing.
Sure.
And frankly, it just happened to me. I had a medical sort of emergency and just got the bill, and it's like, say what? Thousands
Yeah.
and thousands of dollars. So it's this scenario where you're fully insured, but when you end up in any kind of what do we call it, conjoined services operation, some services are farmed out to people that your insurance company says, oh, but we don't cover through them, so you're high and dry. You have to pay them out of your pocket. Is that right?
Well, that's what's happening. And, this is, remember Obamacare was, this was going to be solved and we were going to all be, because they equated health insurance with health care when health insurance is nothing more than a means of paying for health care. But here's what's happened. There is a surprise medical billing thing that's happening. We've all experienced it. And there's two solutions that are being bandied about in Congress. One of the solutions is to create one-size-fits-all flat health insurance rates that the insurance companies are pushing. And they're pushing them very simply because that gives them absolute cost controls and allows them to guarantee their profits based on the amount of money they bring in.
Right.
But the people who get the bad end of that stick are the healthcare providers who suddenly have to make a decision as to whether or not that healthcare that they're going to provide, whether they're going to get paid enough to actually cover their costs. In California, they've tried this for 3 years, and healthcare providers are leaving or not providing services now as a result of this one-size-fits-all kind of plan. So the worst part about that idea is it paves the way for Bernie care. Bernie Sanders is going to win the Iowa primary tonight. He'll probably win in New Hampshire as well. And Medicare for all is going to be all the rage. Socialized medicine is going to be all the rage. One-size-fits-all pricing is necessary for Bernie care to exist. So those who are pushing that, the insurance companies are pushing that approach, are actually paving the way for Bernie care. On the other side, it would be a localized arbitration between the providers and the insurers, with the patients being left out of the process. So, it's not your problem that the insurers say we're not going to pay $5,000 for the bill, and the providers say, but it costs that much. It's up to those two entities to argue out the price. That makes a whole lot more sense and creates an environment where the problem's solved. You and I don't get screwed in the end, and quite honestly, the health insurers aren't driving the entire process. They're having to negotiate with those who provide these services, meaning the people who provide the services are not going to be driven out of business by virtue of of an arbitrary nationwide ruling.
But the problem is it's still third-party payer, right?
Yeah, it's still third-party payer. That's exactly right. It's our ultimate, the best possible scenario would be to sit there and say, as President Trump's done, he says to hospitals, make all your charges transparent.
I thought that Obamacare did that.
For,
that's why I'm confused, because I talked to.
Well, it didn't.
So it just didn't succeed. Because one of the doctors that I talked to, who was for Obamacare, and I was like gobsmacked. What? You're for Obamacare? Why? He said because it makes charges transparent. So now you're telling me they're still not transparent. And the thing is that I got into this scenario because I needed services provided right away, and I didn't know what services I needed. So the medical community determined the services, determined the providers, and then my insurance said, but that's not a provider that we use. And so once again, right,
common.
I was out of the loop because frankly, it's not my thing. I hired them to do the job. They subcontracted it without really my knowledge, in a sense.
And the fact is, let's say somebody's going to do anesthesiology for you. Okay, here's all I know about anesthesiology. I told this one time to an anesthesiologist when he said, my job's to put me to sleep. And I told him, no, your job's to make sure I wake up. Okay, so of course, I started getting the anesthesiology before I said that, so but the fact of the matter is, I don't know who the right anesthesiologist is. I don't know any of that stuff, and neither do you.
Right.
So, we depend on the medical professionals to put the team together necessary to get us healthy. That's what we depend upon. And if in an arbitration environment, those medical professionals will have to say, okay, have to take into account those, the vagaries of the health insurance end of it. But the insurers, on the other hand, will have to create a lot of laxity in their system, their right now lockdown system, and say, okay, we're going to have out of system providers brought in, and we're going to absorb some of those costs as part of our normal expectation in terms of doing business. And when those two things come together is when those two forces negotiate under those circumstances is when you're going to get a fair outcome for both. And it will reflect on insurance rates at some level, because if they are having higher costs, they're going to pass those costs along. But if we do some other things on top of that, like medical malpractice insurance reform, we'll save $60 billion in the system over 10 years, which is a huge amount of money. And those medical providers won't need as much money because they won't be paying attorneys so much to protect them from frivolous lawsuits. So it's a comprehensive kind of approach that needs to be done. But short term, we don't want one size fits all pricing, because it does impact your doctor, it impacts your hospital, and will in fact create an environment where the insurance payments will be determining what health care you receive.
Whether you receive health care.
Yeah, whether you receive it or not, or if you get the right person for the job, because if that right person's out of pocket, is not in your system, you'll get the person who the insurance company says rather than the person who your doctor trusts. And you know what? If I'm being put under for surgery, I want the person putting me under who the doctor trusts, because 10 times out of 10. I'm trusting the doctor, and he has to have the team. That hospital has to have the team that I rely upon, because when you're in that situation, I can't make 10 phone calls trying to find the right anesthesiologist. I just ran my foot over the lawnmower. I've got to get surgery. And, so I have to depend on the healthcare provider to do right by me. And for the insurers then to come in backwards and say, no, you should have had this guy do it or this person do it because they cost 14 cents less.
Right.
Is absurd, and it's not good for the country. It's not good for our healthcare system. And quite honestly, it's the tail wagging the dog.
So what do you suggest people do?
Well, I think what people have to do is they should come to, I'm going to have a website up very rapidly that's going to have a take action on it, to contact Congress and tell them you don't want one size fits all health insurance or health insurance payments, or medical payments. You want a payment system that helps make sure your doctor stays in business. Because the current system's designed to benefit the health insurance industry. It's not designed to benefit your health care.
Right. Okay. So let's see. Do you have a website, any website to give people? If you go to getliberty.org, we have a number of articles about this subject that are up. Great.
And I would suggest that anybody is free, subscribe to the daily briefing we send out, and we'll be covering this topic along with others. The reason this matters is this is going to be one of the things that Congress is going to try to do right out of the box after impeachment's over. And so it's something that people need to get smart about in a hurry and let their members of Congress know that they want to make certain that we don't set the stage for Bernie care by creating one-size-fits-all health care pricing.
All right. Rick Manny, president of Americans for Limited Government. Go to getliberty.org, and also go get the book Necessary Noise that he co-authored with Star Parker. I'm a big fan of Star Parker, so I'm a big fan of yours. So thank you, Rick Manny, for coming on. We'll have you back on sometime soon. Appreciate it.
Absolutely.